All right, Mike. Today we're talking about episode 23 of Co-Created, the role of digital narratives in healthcare innovation. It was with our guest, Dr. Daisy Dulay, and it was released in
Mhm.
October of 2024. What resonated with you in this conversation?
Yeah, lots of things because, I spend a lot of time working with family caregivers,
Mhm,
but always in the back of my mind is this idea of, okay, like professional caregiving, like the physicians, the nurses, the care aides, the long-term care support workers. I mean, wow, they are going through a lot, right? Ever
mhm,
since the pandemic, right? There's been this conversation about this like long-term burnout that people are experiencing. And Daisy just did such a great job of talking about that in her digital story, but then also in the podcast, right?
mhm.
There's this moment where she was just like sort of all of a sudden blindsided by this moment of burnout, and she still had to perform this very important procedure, and yet here she was, just sort of frozen. And anyways, I loved how she talked about the shame and guilt around that, because having spent a lot of time in healthcare, there is something called the hidden curriculum, and it
Mhm,
and it is definitely and I hope this doesn't sound bad, but it's sort of like this hero complex, hidden curriculum in medicine, right? We will save people, we will sacrifice ourselves, we will do what we can, to because what we do is important. Of course, it's important, but it's easy to take that sort of hero mindset too far. And so I just appreciate how she talked about the shame and guilt that occurred when she had to take this medical leave, and because I think those types of conversations is what's going to destigmatize the conversation around burnout
mhm,
in healthcare in particular. So that was the first thing. It's just generally what she's talking about. I just think is so important to talk about. But the other thing that came up as I was listening to it, I was thinking about, in healthcare there actually is something called narrative medicine.
mhm,
And Rita Sharon sort of pioneered this. But the interesting thing about it is it's writing narratives around the patient and the patient's experience. It's not writing physician narratives, right? And I thought, man, we need to turn that around a little bit, and still, it's still the healthcare system is still so focused on the patient, right? And I thought, man, maybe we should, try and turn this narrative medicine idea around back on the physician themselves, right? And do a bit more of some of that reflective writing about their own experiences that then they could turn into a digital story. So that was another thing. And then finally, of course, I was thinking all about, our idea about developing a continuing medical education course for physicians using digital storytelling,
mhm.
where they could tell an important story from their clinical practice or training, that will help in those moments of feeling burnt out. They can go back to the story, they can watch it, they can be reminded about why they're there and what they're doing, and why it matters. And also just that process of creating the story, I think would be so incredibly valuable for physicians, just like it was for Daisy. So
But
I'm
I
excited.
also think those
Yeah, with
stories
that.
that you're talking about that physicians could be creating to have future conversations. We bring a lot of digital
Hmm.
stories from patient and caregivers' perspectives into the medical space, but
Hmm.
sometimes I feel like that just needs to be also coming from medical professionals themselves. So in a
Hmm.
closed door meeting where maybe the story isn't shared publicly, but they're
Yeah.
sharing it to have those conversations and start those conversations, I think there's an
Hmm.
incredible space there that not just the process of creating the digital stories for physicians, nurses, healthcare
Hmm.
providers, but actually having a way to share and talk about those experiences and what we can learn, they can learn within their sphere of practice,
Internally. Yeah,
right?
yeah,
Yeah.
with their peers, their colleagues.
Mhm.
And there is something called Schwartz rounds. Have you ever heard of that?
I have, but I don't really know it.
Yeah.
Will you explain
Yeah,
it?
it's very similar to what you're talking about, right? It's physicians only, and they just basically talk about a very difficult experience that they had, and with a group of their peers, right? And it's closed doors, no one else is allowed in, right? And it allows them to be vulnerable and to
Mhm.
and to sort of work through some of these incredibly traumatic things, actually, that healthcare providers experience sometimes on a daily basis,
Yeah.
And
Yeah.
so those shorts rounds, I think we could do something called digital story rounds, where exactly the same, right? Where you watch these digital stories, you talk about them, it's physician only. They could be open and honest and candid with each other and slowly break down this stigma and the shame and guilt around feeling burnt out in your work, right? So many places to go here. I can't wait to see what happens happens next.
And Daisy is taking the training with us coming up. So
Yes.
she's actually going
Yes.
to become a facilitator, a digital storytelling facilitator. And I think that just sets us up to
Mhm.
kind of think about what are some other projects where Daisy can support physicians in telling those stories.
100%. We're gonna be a stacked team. We're gonna make some changes in healthcare. That's for sure.
We're going to keep making changes in healthcare.
Keep making changes, you're right. But for physicians this time, right? We've done a lot with patients and families, but I think, it's time that we started talking to the professionals as well, the professional healthcare providers.
I agree. So we're talking about episode 23, the role of digital narratives in healthcare innovation. It was with Daisy Dulay. Mike, thanks again for all your thoughts. The links to the
Mhm.
episodes, as well as Daisy's story and how you can connect with Daisy, will be in the show notes.